name's Monique. I'm going to be the PA student seeing you today, if that's okay.
Yeah.
I'm going to just wash my hands while I do that. Can you confirm your name and date of birth?
Yeah. Ashley Rada, 7/20/1983.
And what would you prefer I call you?
Ashley's fine.
Okay, perfect. Okay, so what did you come in here for today?
I have been having some vaginal discharge for a couple of days now.
Okay. Could you describe it for me a little bit?
Yeah, so it started right after my last cycle, and it's been kind of like whitish.
Okay. And you said it's been going on for how many days?
3.
3. Have you noticed there's a time of day when it gets better or worse?
No, it's just kind of
Consistent?
consistent throughout the day, yeah.
Okay. Has this ever happened before?
Not that I can remember, no.
Okay. Okay, so you said it's a little whitish. Could you describe like the consistency for me?
It's kind of like mucusy, like sometimes it'll kind of
Clump out, yeah.
yeah.
Okay.
But it doesn't have like an overwhelming odor to it, I don't think. I haven't gotten super close to it, but
Okay.
yeah.
All right, thank you. Have you noticed anything that makes it worse?
Nothing that really makes it worse. It's just kind of irritated most of the time.
Okay, and anything that makes it better?
No. I
Okay.
haven't tried too much. I kind of figured I'd just come in and...
Have you tried any like medications, anything like that?
No, I tried this like lotion that I read online. It was supposed to help kind of soothe itching.
Okay, was it external or internal?
It was external.
Okay. Do you know what kind of lotion it was?
No, it was supposed to be some like herbal lotion
Okay.
that was supposed to kind of like,
Soothe everything.
yeah.
So is it really itchy as well?
Yeah.
Okay, any pain when you urinate?
Only when I like white.
Okay. Have you had any pain during sex?
No.
Okay. Have you been seen by another doctor or gone to the ER urgent care for it?
No.
Okay. All right. And have you noticed you've had a fever or anything like that?
No.
Okay. And have you tried any new products, any new like foods, anything you did clean with?
Well, I just tried waxing, and that's why I tried the lotion, because I heard that it helps soothe like itching and any like bumps or anything. But that's the only new stuff I've tried.
Okay. Was the waxing before or after the discharge started?
It was before.
Okay. How long before?
It's about 2 days.
Okay. All right. Okay. Is there anything else going on that you can think of?
No, just discharge.
Okay, perfect. So I'm just gonna go over this with you really quickly, okay? Oh, actually, you know what? A couple more questions, and then these ones are gonna be a little bit more sensitive. Are you sexually active right now?
I am, yes.
Okay. How many partners?
Currently just one.
Just one, male, female, or
Male.
it's just one. Okay. And are you practicing protected sex?
Yes. The baby factory is closed for now.
Good.
So,
What do you use?
condoms, and then I take an oral contraceptive.
And which one?
The pink one.
The pink.
Yeah.
Okay.
It's got like, I think 0.1 estrogen in it.
Okay. We'll look more into that and see if we can figure out what that is.
Yeah. It's got such a long name, I don't really know. It's like diestro something.
Okay.
Yeah.
All right. When was your last menstrual cycle?
It started about a week ago, and it lasted for about 3-ish days.
Okay.
Which is pretty normal for me.
Mm-hmm.
Hard and heavy and short.
Okay. Was there any sort of complications or abnormalities with that?
No, very normal.
Okay. All right. Have you had any pregnancies?
I've had 2 pregnancies.
And how many living children do you have?
I have 3 living children.
So where'd the other one come from? Adoption or?
No, it was a twin.
Oh, okay,
Yeah.
cool. That's really neat.
Yeah, that's why the baby factory shut down for a while.
I can see why.
Two at the same young age is a lot going
Yeah,
on.
I can imagine. Did you have any complications with those pregnancies?
I did have to have emergency C-section with the twins, but they did go to full term, which is great.
Perfect. And have you been diagnosed with any fertility problems?
I had PCOS when I was younger, but it kind of resolved with the children.
Okay. Alright, so I'm just going to go over this with you really quickly. Alright, so you've had vaginal discharge for the past 3 days. It started right after your last menstrual cycle, which was totally normal. Not the discharge, the menstrual cycle. You did waxing a couple days before and you tried that calming lotion, but other than that, nothing makes it better or worse. You don't have a fever, you haven't seen anybody else for it. You did say it was white, kind of mucusy. You only have one sexual partner, you do practice protected sex, and then no complications with your previous 3 pregnancies. You did have PCOS, but it's resolved now. Everything that sound accurate?
Mm-hmm.
Okay, perfect. I'm going to just move on to your past medical history, if that's all right.
Yeah.
Have you been diagnosed with any illnesses?
Just the PCOS, and it was pretty well controlled.
Okay.
Until the pregnancies, and then.
And when were you diagnosed with that again?
I want to say I was about 16 when I got diagnosed with it.
Okay. Do you take any medications other than that birth control?
I'll take like a women's one a day, but that's more of like a vitamin than a medication.
Okay. Do you have any allergies?
Just seasonal allergies and cats.
What happens when you're around cats?
Hives, and then my throat kind of closes up, my eyes get red and swollen.
Okay, but none to any medications, correct?
No medications, no.
Perfect. Have you ever been hospitalized where it was severe enough you stayed overnight?
Just for that C-section.
Just the C-section, okay. Not even with your first one?
No, that one was easy breezy.
Oh.
Went into work around lunchtime, had to go to the hospital, and we were out fairly quickly after that.
Wow, impressive.
He was ready to come into the world.
Yeah, sounds like it.
Yeah.
Any surgeries other than the C-section?
Nope.
Okay, and with the C-section you said no complications, correct?
No.
And when exactly was that?
It was about 3 years and 2 months ago.
Very specific, I like it. Have you had any sort of trauma that's required medical treatment?
I was in a car accident, but I only got a concussion. I didn't have like any broken bones or anything.
Okay. Perfect. And have you had any recent travel?
Sadly not.
I figure it's probably hard with 3 little ones, so.
Yep.
Are all of your immunizations up to date?
Yes, they are.
Okay. And did you have any youth illnesses?
Not that I can remember, no. I had like recurrent ear infections, but I don't know if that's what you're looking for.
More like chicken pox, anything like that?
No, just ear infections.
And are you up to date with all your yearly exams?
I'm getting closer to needing my women's exam, but I have been fairly consistent every year.
Okay. We'll get that taken care of then. Okay, so moving on, I'm going to do your family history. So when I ask you about your family, I mean biological parents, grandparents, children, and siblings.
Okay.
So let's start with your children. Are all your children healthy?
Yeah, just the normal bumps and bruises, but everything else is good.
Okay. What about your parents?
Both of my parents are alive. My dad's got some heart issues, but nothing too serious. He uses just some like blood pressure medication. And then my mom has kidney stones, and she's got about 4 of them.
Okay. Do you know when your dad's heart problem started, about how old he was?
He was in his 60s when they started.
Okay.
He just kind of had retired, so he wasn't as active.
Mm-hmm.
Yeah.
Okay. And what about your dad's parents?
Both of my dad's parents have passed away. They were in their upper 80s when they passed.
Do you know why they passed?
My grandma passed from breast cancer, And my grandfather passed from kidney disease.
Okay. Have you noticed that breast cancer runs in your family?
She's the only one that's ever had breast cancer in the family.
Same with the kidney disease?
Well, I mean, my mom has kidney stones, but that's on the opposite side of the family, so
Mhm.
yeah, I don't know.
Okay. So what about your mom's parents?
Both of them are healthy. They're in their 80s at the moment.
Okay. And any siblings have any sort of issues?
My brother's got a seizure disorder, but it's been fairly controlled. He got off his medication and is just kind of controlling with diet and sleep now.
Okay. And how old is he when he was diagnosed?
8.
8.
Yeah.
Okay. All right. Have you had any family history of psych issues in your family?
Just like some depression on both sides of the family,
Mm-hmm.
but nothing too severe.
Okay. Any sort of alcohol or drug dependence?
No dependencies.
Okay. Perfect. I'm just gonna move on to your social history now. So all of this is confidential, just between you and me, and just to help me get a better picture of what's going on. Okay.
Okay.
So how would you describe your home life?
Kind of hectic. Usually starts pretty early with the 3-year-olds picking us up, make breakfast, get ready for school, drop off the older one at school, husband goes to work, and then I drop off the 3-year-olds at daycare and go to work. And then usually I'll pick up the oldest one from school and my husband will pick up the kids, and then we'll meet at home for dinner and all the craziness entailed after that until bedtime.
Yeah. So what do you do for work?
I am a business consultant.
Wow, that's really cool. So
Yeah.
what kind of school did you have to go to for that?
I got my master's in business and communication.
Wow, impressive. That's really cool.
Yeah, I enjoy it.
And still managing a family, it's insane.
Yeah, not as much travel anymore as I was when I was younger, but
Yeah.
family over travel.
Not that anyone's really doing much traveling these days. So.
Exactly.
So with that whole busy thing, do you feel like you've got a good support system going on to help you?
Yeah. My parents and his parents both live fairly close.
Mm-hmm.
And then we've got a good support system with our friends.
That's really awesome. And like in your busy, hectic day, do you feel like you get enough time to like eat healthy? Like what does your nutrition look like?
Yeah, I'd say we eat fairly healthy. I try to make sure my kids have a wide variety of foods. Can't let them be picky eaters. So I try to incorporate lots of fruits and vegetables into like breakfast and dinner.
That's really good.
Yeah.
Good to hear.
Of course, we have the occasional dessert every now and then.
I mean, I feel like it's good for the soul, right?
Exactly.
So what about exercise? I know chasing kids kind of feels like exercise, but anything other than that?
During like lunch, sometimes if I have a little bit of a break, I'll kind of walk up and down the stairs while I eat my lunch.
Okay.
But that's kind of the extent of my exercise besides chasing the kids around.
Okay.
Sometimes we'll go on a hike during the weekend.
Oh, that's awesome.
Yeah, but it's not like a vigorous hike with 3 kids.
It's better than nothing, right?
Yeah.
Just get moving.
Nice to be outside.
Do you smoke at all?
I do not, no.
Okay, perfect. Any other tobacco products?
No, not tobacco products.
Okay, perfect. What about alcohol?
I have the occasional drink every now and then.
I figure you probably need to.
Yes.
About how much and what are you drinking?
Sometimes I'll have like a beer when we go out. And then on the weekends, sometimes I'll go and have like a glass of wine with some friends.
Okay. Perfect. And then any recreational drugs?
No, before the children, I was doing a little bit of like CBD oil and stuff to help like sleep, but I haven't been recently. You get tired enough.
Yeah. Okay, perfect. And then I think that's it. So we're gonna move on to the next section.
Awesome.